Hello friends. So today in real life, real patient, real stories, we are going to discuss about a very interesting case that we had a couple of years ago. In this story, we learned something from a fellow doctor as to how we should approach things in our life, not just in patient or healthcare, but as a person, whatever field we are in, we should approach life in this manner. It's a very interesting case. So there was an elderly woman who was admitted in our hospital for some XYZ complaint. Now she had a fall in bathroom late at night when there was no one around. She had gone to pass urine and on her way back she had a fall. She had some bleeding, some small wounds over the side of her head, and she lost consciousness for about 5 to 7 minutes. When she was stable, she regained consciousness, and the next day she had a swelling over her head. Now she was feeling a bit weak, and the muscle movements, the limb movements were a bit slow. So we were worried as why she had a fall. Is this weakness in her limbs and her body a sequelae of the fall during which she sustained some brain injury or some minor brain damage, or was it initially a brain injury which caused her to fall down and subsequently led to this series of events? So we were really worried as to how to approach this problem, and the answer was pretty simple, that the patient is stable, so we should shift her for a CT scan or probably an MRI. But what to do? Should we do a CT scan? Should we do an MRI? The patient was not that affording. So how to take this decision? Or is it really required? Is it just a simple injury by slipping of her foot? We asked the patient. She did not have any recollection, any memory of the event. She said that I was coming outside and then I don't remember anything. I just remember that I am sleeping on the bed and people are around me telling me that I fell down. So now it was a real suspense. So one of our fellow doctors or anesthetist, she actually had a very wonderful idea. Now this is going the extra mile that we are talking about. What is going the extra mile? So it is doing something to help someone which is not actually expected of you. It does not lie within the domain of your work or your responsibilities. It is doing that extra to help someone, to do some good, so that we reach our end goals. So this ma'am had such a beautiful idea. She said that why don't we check the CCTV? There was a camera which was directed towards the bathroom also, or at least towards the entrance of the bathroom. So probably we might get an idea as to how the events transpired. So definitely we saw the CCTV footage, and surely enough we saw that the patient had probably had a blackout because she started to move at the same place, and then she started to grasp something, and because she could not hold on to something, she fell down. So it was probably some blackout event which led to her losing her balance and falling down. So it was surely something related to the brain which happened before the fall. Now we had a pretty good idea as to what should be done. We did an MRI and there were some ischemic changes, that is, the brain was not receiving proper blood supply in some areas, due to which she lost her balance and she fell down. But because of this very beautiful idea, we were able to decide how to proceed further and what is to be done for the patient. Then obviously the neurologist came and whatever treatment was given. The patient also did well and was discharged in a good condition. Now actually the madam, being an anesthetist, had need not think in that manner as to what happened to the patient. She could have just said that we'll get a CT done or an MRI done, see if it shows something. If it does not show, we will do the other test. So that could have been the easy method out. But due to the financial background of the patient, due to her being an old age elderly woman who would also have some difficulty going to 2 different scans, and to save the patient from that financial burden, she thought out of the box and went the extra mile beyond the capacity or the requirement of her work, her job, and gave this beautiful idea. So friends, what I am trying to say in this story is, it was a beautiful lesson to be learned that even if some problem in your life, in your colleague's life, in your friend's life does not really lie in your domain, it is not your responsibility to solve it, or it is not the responsibility of your routine responsibilities or your job or your social ties, you should always think out of the box, go the extra mile to help out the patient or the person who is suffering. Thank you.